Hello and welcome to the Pharmacy Informatics Professor 2020 with your host, Dr. Armin Simonian. I'm smiling because I just read an article that really made me feel good about picking pharmacy informatics as my specialty area of practice within pharmacy. Every year, ASHP does a survey of pharmacy practice overall in the acute care setting, in the health system setting. And it's interesting. They look at the medication use process and they take two of the topics within the medication use process. And we've talked about the med use process many times before. They'll take two of those and they will do a survey to see the current state of pharmacy practice within those two areas. And then they repeat the survey every year. Each year they'll pick another two topics depending on what was selected the time before. So they'll pick two new topics within the continuum of the medication use process, and they'll survey that. And then next year, survey the final two. So they have six focus areas. And every 3 years, then it will repeat. And you can see, looking at the last three surveys, where pharmacy is and has been recently in terms of practice within the health system. So this year's survey was on dispensing and administration. And when I looked at it, I realized that it's really all about technology. So basically, we've come to the point, I believe, where pharmacy practice really is having information technology as our main tool. So let me bring up this survey so we can take a look at it. And very interesting to see what's included in there. So this is the ASHP Survey 2020. And this was just published recently, June 15th of 2021. And here are the six areas of focus within the medication use process. Okay. And I think they might call it something slightly different, like medication use system, but we're talking about the same thing that we've talked about all along in our episodes on this channel. So if we look at the life cycle of the prescription or the medication order, we look at prescribing, transcribing, dispensing, administration, monitoring, and then patient education is the sixth one that ASHP lists here. And as I mentioned, every year they survey and they focus in on two of these areas. So this particular survey that was done for 2020 focused on dispensing and administration. And here are the key points. So again, it's all about technology. So the first point they make is decentralized drug distribution systems now predominate in U.S. hospitals. And what we're talking about is something that I covered in a recent episode where I talked about kind of the history of dispensing in the inpatient setting, where we went from nursing floor stock 100 years ago to unit dose drug distribution about 50 years ago. And then with the advent of automated dispensing cabinets, we kind of got decentralized and went from unit dose cart systems and maybe satellite pharmacies dispensing to having automated dispensing cabinets in most of our hospitals and providing drugs at the patient care areas via these ADCs. The second point they make is machine readable coding. So that translates into barcode scanning, is now widely used throughout the medication use process. So if you look at this, what they're talking about is the entire medication use process. So scanning meds into inventory and out of inventory, getting ready to restock ADCs, scanning for verification within the pharmacy, scanning within the ADC to make sure that we loaded the right drug into the right pocket in the right machine. And then also, of course, scanning at the bedside. So that would be BCMA or barcode medication administration. So barcode scanning, and we've talked about this also in previous episodes, is very important um, for verifying that we have not only the right patient, but the right medication for the right patient. And then the third point that they make is the availability of electronic health information has enabled remote models of care. So we're talking about telepharmacy, we're talking about remote order review. So once you have the EHR in place and you have remote access, or you have that EHR in the clinic, and you can set up telepharmacy or telehealth visits with your patients. And then also you can have pharmacists remotely verifying orders on the EHR because they have all of the patient information available there. They can see the order, they can see the patient, their problem list, their labs, their prior medical history, their current drug therapies to look for interactions and other issues, their allergies. All of that is available. So we can do remote order review of every order that's prescribed or written, entered via CPOE within our health systems. So again, very interesting that we've come to the point where a survey of hospital pharmacy practice has ended up showing us that it's all about technology. So makes me feel good. I think that the work of the pharmacy informaticist really has become more and more important, and every health system should have a pharmacy informaticist on board, making sure that the implementations of technology are done in a safe and effective manner, and that systems are monitored, and that we're providing the best care using these technology tools. So I'm going to challenge everyone to look at the survey deeply and read it. And what I want to do in future episodes is focus in specifically on some of these topics, because each one of these topics within the survey, they did a lot of good detail work on surveying directors of pharmacy to see how their staff is practicing within that institution. And they got into a lot of the details about how these specific technologies are being used. So I'd really like to focus in on each one of these in a separate episode going forward. So look for those, and we can compare notes as you watch the episode. You can, if you've read the survey, then you can see if what I'm telling you really is equal to what you saw or read, and if you're in agreement with what's being said within these surveys. But I think the bottom line is, hey, it's all about technology, and good work, pharmacy informaticists, and good area of practice to get into. All right, so if you like this video and found it interesting, then please like it and subscribe to my channel, and I'll thank you for that. And in the meantime, stay safe, stay healthy, look after the health of others, and I'll continue to work on those future episodes, and I hope to see you next time. Take care.